Today we are, thanks Shay. Today we are excited to have Dr. Jibran Khokar here to discuss how to talk to teens about drugs and recent advances in neuroscience. Dr. Khokar completed his undergraduate training at Queen's University and his PhD in the Department of Pharmacology and Toxicology at the University of Toronto and the Center for Addiction and Mental Health under the supervision of Dr. Rachel Tyndale. During his time, Dr. Khokar was awarded a Canadian Institute of Health Research Award in Tobacco Use and Special Populations Fellowship, as well as a publication award for Best Publication in Neuropsychopharmacology. He then completed a postdoctoral fellowship in the Department of Psychiatry at Dartmouth College with Dr. Alan Green. In addition to numerous travel and poster awards, Dr. Khokar held a CIHR postdoctoral fellowship, as well as a National Institutes of Health K99 ROO Pathway to Independence Award from the National Institute on Alcohol Abuse and Alcoholism. Dr. Khokar has been an assistant professor in the Biomedical Sciences Department at the University of Guelph since 2018 and was recently promoted to associate professor with tenure. Welcome, Dr. Khokar.
Hi, everyone. Sorry, my ability to unmute myself had disappeared. It's really nice to be here. Having spent 5 years in New Hampshire, I miss New England. It must be nice right now. Probably got some snow as well in the last couple of days, but this is the nice time of the year in New England. So I miss that. And I'm so excited to be here, and thank you, Trisha, for the invite and to get to talk to you all about something that I spend most of my waking time and sleeping time thinking about. Usually I'm either working on the research or the papers during the morning, and at night while I'm sleeping, that's when some of those ideas come, and some of those questions that you've been trying to solve during the day come back and sort of keep you up during that time as well. So today we'll be talking to teens about drugs. It's appropriate that this is happening on 420, which is, the National Cannabis Consumption Day or International Day of Cannabis Consumption. And so we're just 3 hours and 14 minutes away from it hitting 4:20 p.m. on 420. So we'll try to use this time to maybe learn a couple of things as we're going along. I'm going to try to not focus on graphs too much and tell more of a story. And then in addition to that, I'm happy to take questions as we're going along as well, just so that, if something comes up, so you don't have to remember the question all the way to the end of the talk as well. And so a little bit about myself and how this is important for me just as it is for you. So, I've got skin in the game. I have two kids, two boys. They're 5 and 9, and these are conversations I'm preparing for right now and hope to use. It's not just going to be do as I say and not as I do, but hopefully I'm going to be able to use some of these tools as I begin those conversations as well. So as a parent and a neuroscientist, I often find myself applying things that I learned from one part of my life, the lessons that I learned from one part of my life, and applying them to the other. And this was especially true in these last 2.5 years in the era of working from home, where I found myself doing both at the same time, including today. I was mentioning earlier, our school has been shut down due to an outbreak. So both the kids are at home, so they might make an appearance when they hear me talking about them today. So as the dad of a 5 going on 14-year-old, one word that has lost almost all meaning in our household is no. No matter how many times it's said, the different ways it's said, the sternness of the tone, the amplitude of the voice, the pitch, the shriek, the results are often the same. And for a child who loves and relishes scary things, including wanting to hear scary stories before bedtime to dinosaurs, there isn't much in the way of fear tactics that works either. And so, how does this relate to the topic today? Well, unfortunately, that's the approach that public health messaging for the longest time has taken, with substance use, starting going as far back as Nancy Reagan's Just Say No campaign, but then, reefer madness, and, there was all sorts of layers of racism and xenophobia baked into some of those campaigns as well. But even more recently, this vaping, the real cost campaign, vaping can put dangerous chemicals like diacetyl into your lungs, and you can, see the physical changes. And so, they've tried these fear-based mechanisms or these complete abstinence-based mechanisms to try to enact change in teens. Unfortunately, years of studying the brain have told us that behavioral change isn't just as simple as just saying no, or telling somebody that don't do this and they will listen. In fact, even the last first lady tried to use a similar messaging around be drug free when it came to honoring National Substance Abuse Month. And it's interesting because we have been able to make changes, and we have been able to do something to substance use over the last little while. So what does work? Well, there's another parenting example that I will use to help illustrate this. The second most commonly used word in our house, aside from no, is why. And these are with two boys that are below the age of 9. And it can be heard in all sorts of situations, ranging from us asking them to do something and they'll respond with why, or why one has touched the other stuff. Or often, in the last 2 years, between the parents saying, why did we get ourselves into this, or why did we do this to ourselves? Asking the why question is important both for the teens who are making decisions regarding their substance use, and they are going through this period of increased autonomy and a need for that increased autonomy, but also differentiation both from the parental unit, but also their surroundings, and developing their own identity. But it's also important for researchers like myself to establish either the why or why not adolescents should or should not use drugs. And educational campaigns that are related to the evidence-based consequences of substance use, as well as equipping teens with better social skills, have helped. They have been successful in bringing down the rates of substance use to historical lows. And so I'm going to be sharing some of the data. This is data from Ontario, where I am, but I also have now included data from the US as well. So that it's similar trends across North America. So this is in Ontario, you're seeing alcohol and cigarette use is the lowest it's been since from the 70s to now. Cannabis, on the other hand, in Canada, is having a moment, especially post legalization, where there's still flutter. And cannabis, actually, compared to the US, even Canada has historically had higher rates of cannabis use as well. So that one hasn't shown the same trends and decreases. When we look at data, this is from the National Institute on Drug Abuse, and so they, were one blanket statement that I want to leave everybody with here is, if you're looking for resources from talk toolkits to resources around substance use, and especially in teens, the National Institute of Drug Abuse is the one-stop shop, the best place to go for evidence-based information in this regard. And so I really suggest that you try to look there for resources, and they will help equip you with that evidence that then can answer those why questions when you are faced with them from the teens, as an example. And so here we can see past year alcohol use. There you can see significant long-term decreases across all grades. So 8th, 10th, and 12th grade from 2009 to 2019, and even in cigarette smoking. And that decline has even more of a steeper slope, and now we're at rates that are relatively low, anywhere between 2.3% in 8th graders to 5.7% in 12th graders. And so that decreasing trend remains. Unfortunately, that's not the case with all drugs. So this is data from the Ontario again. This is related to e-cigarette use and vaping. Something that now, before this pandemic, that was the epidemic that we were talking about. Right now our definitions of epidemics have shifted slightly, and so we might be more careful calling things epidemics going forward. But this was the thing that was being talked about, and so this is between 2015 and 2019, and we've seen doubling of those numbers of vaping in, and this is again in high school students in Ontario. And the data from the US is very similar. So between 2017 and 2019, more than doubling even of nicotine vaping in the past month, as well as THC vaping in the past month. And these trends have sort of continued, and they're starting to level off now in 2020 and 2021. But those numbers are nothing to scoff at, right? The 25% of 12th graders reporting vaping nicotine, and 14% reporting THC vaping, and this is across the country. Not differentiating between states that have legalized cannabis or not. And the other thing that THC vaping provides is a more discreet way of consuming cannabis that does not have the usual telltale signs or smells associated with it. And so there is this increase. And while the nicotine vaping seems to have plateaued off, we're not really seeing that same plateauing with THC vaping, even with the more recent data. And so vaping remains a problem. But in the last year or two, there's another more acutely problematic issue that's arising. And that's overdose mortality in teens. And you can see here, while it remains low for most drug classes, it's the illicit fentanyls and synthetics that have taken this sharp increase in cases. And importantly, in all of this, even though I'm a neuroscientist first, and I often end up using this biological reductionist approach where it's all about the brain and we have to learn what's happening in the brain, learn what things are doing, it's important to consider the sort of social determinants in all of this as well. And we're seeing across multiple demographics, but especially in underrepresented and marginalized groups, we're actually seeing even a more substantial impact in overdose mortality among American Indian or Alaska Native populations, as well as Latinx populations. And we're seeing a more profound increase in those numbers. And the numbers are very similar in Canada as well. So it's important to think about this. And this actually goes back. So before we get into some solutions, potentially, this actually goes back to some of our education and drug education programs as well. Unfortunately, the just say no approach has ill-equipped or has left, sorry, I thought somebody had a question, but there was just a chat message, but has left them ill-equipped in terms of knowledge about what the risks might be or what they might be consuming. And so while for a while there, we thought that teens were protected against overdoses. And that was a good thing until now that it seems like things are catching up. But what we know from this data is that, and related data, is that they're not necessarily going out seeking fentanyl, which is sometimes the case with opioid users, as an example. They're not going out to seek illicit fentanyl. They might be going out to seek other pills or other agents, but the poisoned drug supply problem that we have ends up affecting them as well, where now fentanyl may have made it into the supply of these pills or other agents that they're seeking out, that then ends up impacting them inadvertently with a similar risk in terms of what those overdoses look like. And you can really see that, now we're up above 4 deaths per 100,000, whereas just in 2019 that was hovering close to 1. And so this is where it's really important for us to evaluate what are our messages. What are we talking to teens and students about? And so one such approach that I wanted to share with everybody today is the safety first, a reality-based approach to teens and drugs. Some of you may have already heard about it or seen it. Others, you can easily Google it. And it's a really nice program that tries to put the horse back in front of the cart again, and in terms of both helping the teens and the students realize the reality of it. And oftentimes the just say no approach is met with some skepticism, because they often see the adults taking part in using alcohol or cigarettes or cannabis, and whereas the teens are being told to just say no. And so it's important for us to take more of this reality-based approach to teens and drugs. So I would suggest checking out the safety first approach. It has includes a lot of evidence-based resources around how to talk to teens about substance use, but especially in relation to, we'll talk about how we're using the knowledge that we're gaining about the brain to inform students and inform teens about the effects of cannabis use. But two things that I wanted to reinforce here, especially for the audience here and the nature of this program, is that with this recent rise in opioid overdoses or synthetic fentanyl overdoses in teens, we need to first and foremost equip them with knowledge around signs of an overdose, as an example. So what are the symptoms? What does it look like? Nausea, rapid heartbeat, headaches, confusion, drowsiness, and then more life-threatening seizure complications like seizures, cardiac dysrhythmia, and then respiratory distress, which is often accompanied with overdoses and often results in the deaths that are associated with these overdoses. And there are two practical points that I wanted to share. First starts with Narcan and training on how to administer it. Nobody's too young, nobody's too not mature enough to be able to handle it, especially teens. If we're seeing these cases happening, then that should be a part of our arsenal in terms of training that's being provided. But secondly, also, and just as importantly, to ensure that teens are together, are with their friends, are with the groups that may be able to both administer Narcan and also recognize those signs of the overdoses, that then can intervene in time to prevent some of those adverse outcomes that we have been talking about. So now switching over from more of the PSA portion of this to the other half of my talk today. And it's important for us to think about this, you know, in a few different ways. Firstly, I'll go back to the data that I was presenting about vaping and e-cigarettes. While no one knows exactly why these massive increases in the popularity of e-cigarettes have happened, it might be related to the perception that they're free of harm or safe. And while that is true, you know, that perception comes from the fact that e-cigarettes were designed to help smokers switch from harmful cigarettes to these electronic nicotine delivery devices. And so while these e-cigarettes are definitely safer than regular cigarettes, that's not exactly a high bar. But in addition to that, you know, these teens now are digital natives, and other potential reasons that may have resulted in some early adoption might have been attractive social media influencer based marketing, as well as misinformation about the contents of e-cigarettes. And I remember when we started talking about New England, I remember giving a talk now, maybe 5 years ago, at a sorority at Dartmouth College. And after I finished the talk, all of the questions that I got were about Juuls. And this was the first time I was hearing about them. I was the not cool postdoctoral fellow who didn't know what the newest trends were on campus. I hadn't heard anything about Juuls at the time. And so I asked them more about it, and they said, you know, these are just flavor pods with no nicotine. And, you know, that statement couldn't be further from the truth. And that was the first time that I recognized the need for additional education as well as research on this topic and a goal for my lab in the future. But also important for me to remember as I continue to talk about these things is that, you know, to take what I'm hearing from conversations like these and then take them back to the lab to begin to figure out what it is that might be happening. And so, since these devices and now these trends in fentanyl use are relatively new trends, very little is known about them and their long-term consequences, especially when used by adolescents. E-cigarette use in youth has been associated with the concurrent use of multiple other drugs, alcohol, opiates, as well as the future use of cannabis and transitioning to combustible tobacco products. Those who used e-cigarettes were also significantly more likely to report having ADHD, PTSD, gambling disorder, and anxiety. And that's what the graph that you're seeing on the screen, these findings are largely consistent with the great wealth of literature around effects of substance use in adolescents. These studies, some retrospective, others longitudinal, have identified three major domains in which the effects of adolescent substance use can be seen. And these three domains are cognition. So for the most part, a net decrease in cognitive ability, risk for future substance use, and the development of mental illness. As far as risk for substance use and future substance use is concerned, and this is, I think, an important thing for us to talk about in today's talk, is that substance use is in fact considered a pediatric disorder in that it starts usually in the teenage years. And the earlier you start, the more the likelihood of you going on to develop a substance use disorder. And the later you can push it, the more you can delay it, that risk decreases with every passing year after that. And so it's really important for us to consider, a delaying approach, or to wait and, to start low and go slow approach when it comes to substance use, instead of the just say no approach, which unfortunately, even with the DARE program, the data itself shows that if anything, those students compared to a control group use drugs just as much or even more so than the control group. And so the issue with these findings that I've just told everybody about, and even the ones that are on this graph here, is that they're just association. And it is very difficult to assess whether adolescent substance use causally contributes to the development of any of these effects. Maybe these are just two distinct populations. One that was going to use substances and then was going to have these effects happening in the future anyways, especially due to the genetic overlap between substance use and some of these serious mental illnesses. A lot of the work that we do in our lab is related to cannabis use and or substance use and schizophrenia. And so the most common association that you often hear is that cannabis use leads to schizophrenia. But that, part of that problem is that cannabis use always starts and happens before schizophrenia, because this happens, when you're 12 or 13 years old, whereas schizophrenia happens when you're 18 to 21 for a male versus 21 to 23 if you're female. And so it might seem like one comes before the other, but it doesn't necessarily mean that one leads to the other. And so that's where it's really important for us to consider research that then gets to the causal nature of the problem. What is a direct effect? How can we draw those lines from adolescent substance use to all of those effects that I just mentioned? And so one example that I just started talking about is the link between cannabis use and schizophrenia. And while cannabis use, especially during adolescence, has been associated with an increased risk of schizophrenia, the high incidence of cannabis use in patients with schizophrenia makes it also difficult to assess what gave rise to what. It could be that a person with schizophrenia just has an increased susceptibility or vulnerability to use substances, and that earlier symptom of using cannabis may have just been an earlier onset of that symptom compared to other psychotic or positive or negative symptoms. The same case can be made with the association between e-cigarette use and the future risk for cannabis and tobacco use, where individuals more likely to use e-cigarettes may have been the same people that would have gone on to use cannabis or tobacco anyways, possibly due to underlying traits like impulsivity or risk tolerance or sensation seeking, which are known to affect somebody's ability or somebody's proclivity towards using substances, especially during adolescence. And so the reason I end up looking off to my left is that's where everybody's faces are, and that's where I want to make sure that there are no hands up that I can see that might have some questions. There's something in the chat. And LK asked, please correct me if I'm wrong, but it seems that a harm reduction approach is essential when talking to youth about substances. And yes, cannabis and not marijuana. As we started earlier, when we started talking about, the reefer madness, there's all sorts of racism and xenophobia that's baked into so much of our drug policy and so much about how we even talk about drugs. Even the use of the term marijuana over cannabis, it relates to that. And then that's worsened even more when you think of incarceration rates, and so there's all sorts of social determinants of health that impact policy that necessarily aren't related to the science behind it. So it's an important reminder for all of us to continue taking that anti-racist and anti-oppressive approach to substance use as well. And you are totally correct. A harm reduction approach is essential when talking to youth about substances. So even the program that I was talking about earlier, I think takes that approach, and that's the approach that we should be using instead of fear tactics or just say no or abstinence based approach. And so part of the problem trying to study this as a neuroscientist is that while we can look at longitudinal studies, we can't really dictate a person is going to get a drug versus another person is going to get a controlled substance, or the controlled condition, not a controlled substance, but a controlled condition, and then we could compare what their outcomes may have been. That would not be ethical and would not be the right thing to do. And so that's where that reverse translation piece that I mentioned in my title is where preclinical studies come in, where we can, preclinical meaning studies in animal models, where we can then reverse translate questions that can't be answered in human studies and establish the causal influence of genetic or environmental factors on the adverse outcomes that I just mentioned. And these studies are done in animal models, and they can provide very valuable information regarding the effects of drug use during adolescence, without the confounds or the ethical limitations that would limit these investigations in humans. I'm by no means the first research to look at this topic. In fact, we're really standing on the shoulders of giants that have come before, that have laid the foundation for us to build upon. From establishing what ages in animal models correspond to human ages. And so these are rodents versus humans. And this is what guides a lot of the work we do. And this is what's great, right? Like in years, you'd be looking at 0 to 19 years is when adolescence ends in humans. That would be a 19-year-long study that we'd have to wait before we could say something conclusively. Whereas we could do that same study in, this is postnatal day, so day 14 to 42. And so that, 14 days of the pre-adolescent period, and then another 14 days of the adolescent period gives us enough time to be able to then look at what are the consequences of substance use or exposure during this period, and how does that change the brain going forward. And it's the reason it's important to focus on the brain, and I might be biased being a neuroscientist, but during adolescence, the brain is undergoing a lot of change. And there is so much literature out there that tells us that the ages that correspond between humans and animals in terms of adolescence and adulthood, but also characterizing the changes in the brain chemical messenger system during adolescence. And there's a rich literature that we can count on, and that for the most part, when we've looked at brains of animals and then compared them to post-mortem brains, for example, of humans, we've seen that the animal brain and the human brain actually goes through similar changes in these chemical messenger systems within the brain during this important period of adolescence. And so the slide that I'm showing you now, it's purposely small and difficult to see, and you're not meant to read what it says on that slide. Instead, the point is across all the different systems that are there in the brain, that are chemical messenger systems, there is flux and change happening during adolescence. Some go up and come down all during that adolescence period. Others peak before adolescence and then drop. And some others continue to drop during adolescence all the way to adulthood. And so this is across all the major known neurotransmitter or chemical messenger systems within the brain. What you can see here is the great complexity that we're working with during this period, but also the uniquely vulnerable period or nature of this period that then makes individuals more susceptible to the effects of drugs from outside. And it's important, for us to put this in context as well. Not only is this period a vulnerable period for the brain, but for those of us that, for those of you that are currently dealing with teenagers at home, this might explain some of what you're seeing as well, in terms of those fluctuations in mood, and they might relate back to the fluctuations in these chemical messenger systems. So I wanted to talk a little bit about what we are doing in our research group and how we're building upon all of this wonderful work that has happened in the field. As some of you might be thinking, what is this guy talking about? rats don't use drugs and they don't have the same issues that humans do. And we don't usually, aside from New York, where you've seen the pizza rat and probably seen rats carrying all sorts of drug paraphernalia as well, it's not usually the case. But what I wanted to share today is that there are ways for us to bridge that translational gap between studies in humans with studies in animals by using tools that help us replicate what might be happening in the human. And so we have in our lab, for example, we've worked to establish routes of administration that more closely mimic the methods used by teens. While earlier studies almost always injected animals with drugs, we have been working to create tools and open source tools so that they can be used by other lab groups and other research groups around the world that allow researchers to expose animals to e-cigarette vapor from Juul devices and pods that I mentioned that I heard about at the sorority, as well as other vaporizers like vaporizers for dried plant materials, anything else that you can vaporize, from shatter to dab to these more high potency forms of cannabis. We can now vaporize them and expose animals to them to begin to understand both what is the difference between the adult brain and the adolescent brain, but also what are those long-term effects that happen as a result of this use. And so, these are some of the findings that we have published already. And so this is from a couple of years ago, where we showed that nicotine vapor was in fact more rewarding for adolescents than adults. And so that might help explain the uptake of e-cigarette use, and in this case it was Juul vapor, in the adolescent population even compared to the adult population, and now allows us to identify what are those changes in the brain that make them or put them at that additional risk for using substances. Another way that we're doing this is by also combining these exposure methods with behavioral assessments, where we can assess, how rewarding do they find it, how much of it will they take, or how much of it will they self-administer, or even in the case of cannabis, if adolescent rats are exposed to cannabis, do they show changes in the brain in terms of brain activity or behavior that looks more like what a patient with schizophrenia might look like. So we can now, by manipulating one variable instead of all of the multiple variables that exist in teens, from societal to environmental to genetic factors, we can control all of those. And the only thing we're changing is that exposure that those animals are receiving. And then we can look at a variety of behavioral outcomes as well. In addition to that, we also use magnetic resonance imaging. And so, I'm a big Zoolander fan. So yes, we do use an MRI for rats. And so this is a 9.4 Tesla MRI. It's a small bore MRI, has a lot more magnet strength, but we're able to assess the same things that we would be able to assess in humans. Unfortunately, not many MRI studies are done in teens, partly related to ethical concerns. There are now big studies happening, like one by the National Institute on Drug Abuse, where they have 10,000 teens that they've recruited that they'll be studying for the next 10 years. It's called the Adolescent Brain and Cognitive Development Study. So that would be another thing that I suggest that everybody here keeps an eye out for as the data rolls out from that, because that will provide some of the evidence that we need to be able to talk about these things with teens. And so what we've done is, this is what the MRI of a rat brain looks like, and what the changes that we see after drug exposure actually end up looking very similar to the changes that, sorry, he's done for the day, he announces. So yeah. So the changes that we see in the brain are akin to the changes that we end up observing in individuals who've been using substances for a while, or even some of the changes that we have observed with this ABCD study. And so one last piece of, I'm at 38 minutes, so I'll probably only take a couple more minutes. One piece of information that we have recently gotten that is really important when it comes to looking at the brain is we were looking at the differences between adults and adolescents, male versus female, rats exposed to Juul vapor for a period of 14 days. As you saw, that's the entire adolescent period, either in adolescence or in adulthood. And then we looked at brain-wide changes. What is happening in the brain? And that's what MRI allows us to do is, what is happening. And, the point here is you can actually see changes across the entire brain. And we don't have to worry about what brain regions there are, but you see this net reduction in activity and connectivity between the different brain regions after exposure to nicotine vapor or Juul vapor in both adults and adolescents. Where we did see a difference is between males and females, and so we're really interested in figuring that out further, because even in the context of humans, we know that the reasons for using e-cigarette devices or nicotine vaping are different between males and females. Males report, especially adolescents, report using it for more of the rewarding euphoria-like effects of the e-cigarettes, whereas females report using it for stress relief or for social reasons. And so it's now what we are able to have is a window into the brain to begin to see where do these sex differences arise from, and maybe these differences can be targeted. Now that we're seeing that this is a reduction in the connectivity of the brain happening, maybe we can develop treatments, maybe we can develop agents to reverse some of these effects as another way of reducing the potential harm that might come from substance use during adolescence. And so with that, this brings me to the end of my talk. And so we'll leave a good 20 minutes or so for questions. But I end up most of the time either doing talks like this or writing grants and papers in my office. And it's actually the students and the postdocs that do all of this work. And so I am grateful to them, as well as my collaborators and funding sources. And then, if any of you or folks that you might know are interested in the research we're doing, we're always looking to hire and take in people that would have an interest in this topic and want to learn more about the brain. And so please get in touch with us as well. And then the funding sources that have funded a lot of this work. And I am happy to take any questions that you might have at this time.
Excellent. Thank you so much, Dr. Khokar.